Okay. Welcome everyone to our 8-part learning series of the Utah School Mental Health Collaborative. We are super excited to really kickstart the series and also kickstart with module 1 today. So we have a team here today from the UTech lab that houses the Utah School Mental Health Collaborative, and we are a technology in training, education, and consultation lab housed within the College of Education. So let's take a minute to go around and introduce ourselves here from the UTech team. And we would love to hear from those of you who are joining us today. And I can go first. My name is Dr. Shatariala Firmawood. I am a postdoctoral fellow here in the UTech lab.
I'm Molly Davis. I'm a clinical social worker, and I help out with the North Summit School District in the collaborative.
And I'm Derek Smith, and I'm the staff psychologist for the UTech lab, and I help with several of the districts as well.
I'm Jocelyn Kazer, and I work as a project developer in the lab. I'm a graduate student in school psychology.
Wonderful. Thank you so much for those introductions. And now we would love to hear from those of you who are joining us today. So if you can tell us your name, your organization or school district, and your role within the collaborative or within your school.
I can go. Should I go? My name is Caroline Ingram, and I'm a school counselor at Slicksy Bryant Middle School in the Salt Lake City School District. And I know we have had a partnership with the wellbeing team for years, but I've been here for 3 years, and I've really enjoyed our collaboration in the past 3 years.
I'm Sean Weeks, and I am consulting with the Logan School Districts with an elementary school up there.
Thank you all. We're super excited to have you and really excited to kind of go through this whole series with you all and, really exchange some ideas about things that have worked for y'all and almost like use this space to like exchange ideas so that all schools can benefit from each other's knowledge and experiences. So first, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from our funders and collaborators. So we have Cambia Health Solutions, the Huntsman Mental Health Institute, ULEAD Education, and the Utah State University. The content for today's training is made possible by the Mental Health Technology Transfer Center Network, we call MHTTC, and the National Center for School Mental Health, NCSMH. So the MHTTC network hosted an 8-part training series using the National School Mental Health Best Practices Implementation Guidance modules for states, districts, and schools. This resource was developed by the MHTTC network in partnership with the National Center for School Mental Health. And really what this series aimed was to help states, districts, and schools advance their comprehensive school mental health and really engage in a planning process for the implementation work. The primary intended audience for this series is district school teams and community mental behavioral health institutions, and also university settings who really provide and develop and also oversee the school mental health systems class-wide, building-wide, and also school-wide. So the guidance modules really includes a trainer and participant manual, 8 sets of slide decks for each module in the curriculum, representing all of the different core features of a comprehensive school mental health. As a part of participating in this series, we will send you a follow-up email with links to access all of this content and resources. So before we get started, a really quick disclaimer. The opinions expressed in this learning session are the views of the presenters and do not, by any chance, reflect the official position of the Department of Health and Human Services or SAMHSA the MSCTC network, and the National Center for School Mental Health. So I wanted to start off with that. And now for kind of the next few minutes, I'm just going to share some of the highlights from this module, just to provide a refresher. But we do want to remind that there is the full module recording available and can be accessed through the flyer that you may have received as a part of participating in this series. So this module is titled The Foundations of Comprehensive School Mental Health. And what it really does, it provides an overview of what the implementation guide entails, but also kind of, provides background as to what really comprehensive school mental health is. How do we define it? And what are some of the core features of a comprehensive school mental health system? So you can see here, there are 8 modules that make up the implementation guide. So we start with the foundations, which we're going to go over today. And then aligned with the rest of the series are the remaining modules that you see here. So we will go from teaming to needs assessments and resource mapping, screening, mental health promotion for all, or what we call tier 1, early intervention and treatment, or what we call tiers 2 and 3, and then we'll move on to funding and sustainability, and impact in terms of when schools or districts decide to build these comprehensive school mental health systems. How do they fund these systems to make it sustainable, and how do you measure the impact and really intentionally provide these services? So the comprehensive school mental health system provides a full array of supports and services that promote positive school climate, social emotional learning, mental health and well-being, and doing all this while reducing the prevalence and severity of mental health illnesses. So if you look at a comprehensive school mental health system, these are built on strong foundations. And these strong foundations pretty much encompass people from the district, school, and school professionals. And when I say school professionals, this also includes administrators, educators specialized in instructional support, including school psychologists, social workers, school counselors, school nurses, and the other health professionals in kind of a strategic partnership with the students, with the families, and with the community mental health and behavioral health providers. And these systems also really assess and address kind of like the social and environmental factors that overall impact mental health. So, in fact, we were talking about some of the core foundations throughout this presentation. So, the foundation modules, as you can see here, are described, and we will go into some of these in detail. So the core features include a really strong foundation of educators and student instructional support personnel that are adequately staffed, that are adequately supported, and also adequately trained. Looking at collaboration and teaming across all of the partners in this work. So like I mentioned, not only those within like the school buildings and the school districts, but also reaching out to community providers and in university settings and institutions who can really provide these services. Then we have the multi-tiered systems of support. So that kind of encompasses like all the way from tier 1 to tier 3. And within these core foundations are also evidence-informed services and supports, and really like seeing what the research has supported when we kind of look into what components we want to bring into our core foundations. And then we want to be culturally responsive too. We do have diverse student populations, and also we have diverse staffing personnel. So we want to be mindful of where our people are coming from, what are their experiences, and really being able to cater equitably to their needs. And then all of these, we have data-driven decision making. We want to strive to collect data in the work we do, and really use that data to really inform how can we move forward, how can we use these numbers to make our system sustainable, what has worked for us in the past, and how do we want to do things differently moving forward. So we ask schools to kind of sit back and really reflect on the content of this module and how that really fits into their system. It can be school-wide, It can be building wide, or it can be district wide. And later towards the, towards the end of this session, we will have like a discussion session portion. So I think that would be a place where we can think as a team about the features that your school, district, or building really have embraced, things that are closely aligned with, the needs of your individual schools. And then we can kind of brainstorm about what are some things that we wish we could see more consistently. So in all of this work, we want to describe the value of comprehensive school mental health. And this slide that you see here, I'm just going to pause for a moment so you can read and identify these visuals that really put things into perspective when it comes to why school mental health matters. So this is just one example of how school mental health matters and what the impact is. And we will go into greater detail on things like access to mental health, but also the impact on psychosocial and academic outcomes. And the fact that much of this data is indicating that youth are more likely, not to engage in mental health services if they're offered in schools, but also to follow through. So I think just to kind of like bring it all together, the goal of this whole series is to try and understand how all of this content that we're going to go through really fits with each building, each school, and each district's understanding and implementation of all of those core features that I indicated to you before. And then from there, how do we move into like the strategic planning? So that we have, each school's specific goals, and, goals are something that each schools have, like something they envision for them as an organization, or for their students, or for their staff. So how do we take these specific goals related to school mental health and then, identify the potential action steps to move towards this goal? So I know that was like a very quick summary of kind of the overall module 1, but I do want to remind that the module 1 recording is available on the MSGTC website, which we will follow up after this session to provide you all the links to access those resources. So we would encourage everyone to kind of take the time and listen to those recordings and really think about how you can use some of that information to and apply those to your existing settings. So with that, I'm going to move on to the discussion portion of today's session. So on here, you will see kind of the core features again that I presented to you a little bit earlier. And just to again go through, we have educators and student instructional support personnel. So this talks about, do we have adequate staff? Are they trained? And are they competent? And then next we have collaboration and teaming. So when it comes to teaming, we're really talking about the well-being teams. And typically, in our experiences, well-being teams have comprised of mental health teams within the schools and administrators, but really teams can also include families, community mental health providers, and also students, especially students in high school settings where they are kind of capable of reflecting on the needs on behalf of their fellow students. Then we have the multi-tiered systems of support. So tier 1 really targets on promoting school-wide, building-wide mental health promotion supports. And then we have the tiers 2 and 3, which really target the early intervention and treatment services for students with high risks and high needs. And then we, want to make sure that all of these, all of our comprehensive mental health systems utilize data-driven decision-making, utilize evidence-informed services and supports, and are also geared to providing culturally responsive and equitable services. So we have 3 discussion questions here, and these really kind of reflect on overall, what are some of the core features? What are some things that your school is currently doing, and what are some things that you wish to see more consistently happening? So we can always, it's always a good place to start with the positives. So what are some core features that your school or your building or even your district are really doing well? We can just take a minute to think and reflect. And while you all are thinking, I just wanted to mention, so something that is up and coming, and we are really wanting schools to move forward, is school-wide screening. And school-wide screening really falls under tier 1. So this is kind of an approach we want to take to promote mental health, identify students early on so we can provide the supports through the classroom, through the teachers. So there are some schools who are kind of in different places when it comes to screening, right? There are schools who are already doing screening school-wide. There are some schools that are kind of getting introduced to the idea of screening. And there are some schools who are almost like pilot, so somewhere in between. They want to pilot screening. So for example, they will start with a classroom or 2 classrooms, just to kind of test the idea of screening and seeing what kind of planning and strategic supports they need to do in order to successfully eventually screen their whole school. So that, for example, could be one core feature that a school or district is really doing well. What are some other things that your individual schools are really doing well?
I think the Logan district is actually doing a pretty good job with screening while they're still getting on board and figuring out the kinks. The one nice thing is that schools do seem to be jumping on and using a standardized system for doing so. So there's a little bit less confusion, I think, about how that's happening across schools, and easier for administrators at the district level to approve what's going out and being used across schools, since it's all kind of in the same vein. So while there's definitely still things that need to be done regarding screening up here, it is nice to see that people seem to be open to it, and a good amount of schools are using it already.
Thanks for sharing that, Sean. Yeah, that's really good to hear. And it's always like every screening opportunity is going to look different, right? There's just going to be multiple challenges. So it's like really nice to kind of explore as you go what works and what hasn't and doesn't work. Caroline, I see you.
Yeah, well, I guess I'm just trying to think of what to say. I mean, we're in the process of screening our students, right? I mean, that's what the SSWQ is, right? And I know we've done various other informal screenings. I think something that we're working on is like some form of tier 1 that all teachers are on board with. And I know we've used different sort of tier 1, whether it was second step or having teachers, incorporate SEL into their lessons. But I think while we all agree that we value it and it's important, I think we don't have like a school-wide system that we're using. I think we're getting there. So I think that's something that we, could work towards. But I think we touch on, a lot of these things in our school, especially with the well-being team support. So I think we're doing a lot of these really well, especially the early intervention and treatment. the more systems that we've been creating, especially the past 2 years since I've been here, like I've seen it. Working with our social worker and with you guys to refer students has been working really well, I think, and seems to be getting better.
Yeah, thanks for sharing that, Caroline. And we're super grateful that we, got to partner with 60 Bryant in like supporting all of this work. Yeah, and like you mentioned, it all had to start somewhere. So initially when you start, things are not perfect, but I think like through the years, and that's the whole point of like well-being teams, to just like sit and kind of reflect on how things have gone, and bring in more people to the team who can give like a different perspective. So and this kind of like is a nice segue to talking about well-being teams. And well-being teams really can involve as many people who are kind of related to education, to students. And like I mentioned, it really can involve parents as well. And I think the importance of including parents is to kind of advocate for mental health services for children in the eyes of other parents. And just like having that person to represent the parent population, I think is a really important factor, because this kind of like allows more transparency between like kind of like opens up that connection between the school and the community, really. And some of the like another example kind of tying back to screening would be just some pushback to screen like the student, right? So I think again that's because just the knowledge and the transparency about what is screening, what does that process look like, realistically, like does someone sit with my child and talk to them, or is my child being pulled out into a different room? So I think a lot of these nuances can be bridged if we bring like more parent collaboration into well-being teams, just to like smoothen out some of these core features in the comprehensive school mental health system. Thank you for sharing all of that. So what are some of the features that maybe your school is kind of doing, but hasn't been consistent, but you wish would have been present more consistently?
I can jump in a little bit and just kind of speak to the last two questions. And one of the things that I notice across schools, across districts, is that everybody's in a different place with where they are kind of developing their well-being team, developing. We've got some schools that are really early on, just starting off, just identifying personnel and creating those relationships with the community. And I think no matter where we are with that, I think we can see those as things that are going well, if we're engaged in that process along the board. And as far as things that I've seen where there have been wishes, it's more consistent. I think screening is one of them, just like Caroline was bringing up. It's like, I think that we want to have a little bit more push, for it to be more broad and some of those aspects. And I think other schools are seeing the same thing. So just kind of like testing it out, figuring it, how can we make this even more accessible to the community or to our school community in our district than it might already be? And I've seen some schools where that's been more of the concern. And then also, how can we use that? So thinking about the data-driven aspect of it, how can we use that to implement other programming or to modify the programming that we currently have? And so just looking at the various schools and the various districts and just kind of seeing who's on board with those things, I see we have a lot of really strong administrative and staff support, and then it's just more about kind of building up these other aspects of it, if that makes sense.
Yeah, thank you for sharing that, Derek. And I think like you pretty much highlighted the fact that schools are definitely in different places. And for schools who are starting off brand new, like with some of these, I mean, schools may feel the pressure to, strive to be perfect and achieve 100% in like the first semester. And I think the reality is there's just going to be a lot of ups and downs. And I think it's okay to kind of like experience those. as long as, you know, you learn from, like, you know, the mistakes that you have made and the great things that have gone per semester or per year, and like really using that to, you know, improve and better for the upcoming semesters and upcoming years. So I think overall it goes to say starting small is really okay. And then, but as long as we consistently keep pushing to obtain some of like the goals that we discussed before, I think that's kind of like where it all trickles down to.
I can speak a little bit to that second question. I think it would be cool to have, because I know that the, you know, the value is here in our school. Like we value mental health, you know, supports for our students and SEL in the classroom and school-wide. Though I think teachers wish that they had more training on how to do that in the classroom, and I think they would feel more comfortable providing, you know, tier 1 mental health supports.
Yeah, I definitely agree, Caroline. I think just like the underlying goal is the value of mental health within schools and implementing those systems. And I think that's a good place to start, and that's where the intention is. So everything else will almost like fall into place if the intention is there and there is work that has been put into it. For those of you who just joined us, we are kind of like going through some discussion pointers right here. On the left here, you see some of the core features of a comprehensive school mental health. And what we're really trying to do is, you know, kind of explore some of these things in terms of like your own school buildings, your schools and your districts, and just like really reflect on some of the things that, you know, your team may be currently doing right now, things that have gone really well, and some of the things that your schools are just starting to do. Some of the things that, you know, they may have been doing sporadically, but, you know, you wish were more consistently present. So the last discussion question for this slide is, how do you think families would respond to the question of which core features the school or district are doing well? I think this is like a time to just like reflect on, you know, some of the like parents' feedback in a sense about, you know, and you know, parents, there are parents who will express the value of comprehensive mental health services. There will be parents who will advocate and encourage these setups being available in the schools for their children. So reflecting on some of those experiences, what are some things that you all believe have gone well according to like in the eye of the parents?
I think some of the parents that I've worked with, especially parents with limited resources, have really relied on the mental health services provided in the school because there's not an option so much for them outside of the school. Even if that might seem like a nice idea, I think the reality for a lot of families is that getting mental health services for each of their children and maybe themselves just isn't going to happen. And so if that can happen at a place where their kid already is and for free, a lot of the parents that I've worked with have been really appreciative for that.
So I apologize, I was a little bit late, so I'm kind of trying to get my grasp on where we are. So this is my second year as a principal at Wilson Elementary in Logan, and we don't have a lot of systems in place for mental health. To be honest, we are starting to build a mental health group or in our school to start getting supports in place. just because we know there's a need. We have parents constantly asking us, do you have a counselor in the building that can help my kids? Do you have social work? And we keep referring them to, to our community services because we don't have. So we're very eager to kind of get some resources, even if it's in our in our teachers' information that they can kind of support the kids as a tier 1, more than even tier 2 and tier 3, so they can actually kind of support the kids. And so we're starting, we're just kind of moving forward because we really see the need, and we have, we're interviewing for counselors, but there's not even availability for people to even interview. So that's kind of where we are. Our families are eager to have counselors. We have them all the time coming, and then they want to meet. And I'm like, I'm not trained. I wish I could help you. So I don't even feel like I have the training to support them the way they need.
Yeah, thank you, Sean and Liz. And yeah, Liz, to your last point, I think y'all are very brave to have started somewhere. And I think it really shows that y'all identified the intense needs of your student population and your families. And we're excited to partner with Wilson for the School Mental Health Collaborative and really see how we can support this year. And I know Sean is definitely working closely with you all. So thank you for really thinking about some of these things and seeing within your capacity, what can you do? And I think you brought out the fact that, partnering with the community mental health providers, which I think is a really good thing. And I think that really helps the collaboration and partnership between school and community. And, often people do see this as two separate entities, but I think when we do join together, we can do really good things and really support our kids. And kind of goes back to kind of the equitable supports, right? There are families who can't afford these services. So I think they really turn into the schools, and just to be able to do that is, I think, a really good thing.
Also, one of the things to kind of bridge that gap a little bit where folks don't have access to a school counselor or to mental health services within the school is really definitely building up that community response and being able to have a very as easy as possible of a line directly to those individuals. And so reaching out to those folks, knowing that they're the ones that we're going to be referring to, and finding out what are their referral processes, what are the things that we can do in the school to really ease that transition over, and other things are what insurances do they take and those kinds of things as well, so that we can make sure that when we're making those referrals that we can just do a nice warm handoff rather than here's a place you can go check in. And it would help with what we're able to do in the schools and help them to understand on the community side, this is what's coming your direction, and these are the kinds of things that we're hoping you can work with. And so even leveraging that community support in that way, and building up the team, and maybe even bringing them in as collaborators to some of these meetings could be helpful, so they can kind of have that smooth transition. Those are good options. And if you're not already doing that, implementing something like that, but if you are, that's great. And those are the ways that we can really build up those supports even when we don't have those resources within the schools.
Thank you, Derek. And I agree. I really want to echo kind of the warm handoff that you mentioned. I think that's really important. And that's another place where we can really show the collaboration between schools and the community mental health providers, rather than families reaching out to the community mental health providers in isolation. And I think that collaboration goes a long way. So this is our last discussion slide. So I think at this point, moving forward is really important, right? So we spend a lot of time and effort implementing whatever that we have planned. And in all of this implementation work, I think one of the key factors is moving forward. So that could mean in terms of sustainability, 3 years from now or 5 years from now? Like, what do we envision for building our school or our district? What, like, how are we planning to serve the future student populations, the future student families who are going to be a part of our community? So it's always important to kind of think almost like 10 steps ahead about like what your plan or your vision is for a comprehensive school mental health system. So kind of thinking about all of those, it's important to have goals because we all work towards a goal. We have this big vision. So it's okay if some schools don't have a goal, right? Maybe they're just getting started. So they're all just new to all of this work, they're learning. And it's also okay for well-experienced and seasoned individuals who are doing comprehensive school mental health work to also not have a goal. But I think the goal would be to have a goal so that we can like be sustainable and just like keep providing continuous services and also like improve ourselves on the way. So I think this would be like a two-part question. Does your school, your building or your district have a specific goal? And if so, what would that goal be? And if not, it would be, a good idea to like go back to your well-being teams and sit together and, talk as a team about what is our plan moving forward? So let's just like maybe take a couple of minutes to kind of think through a specific, and I know some schools do have a lot of goals and that's great, but I think just like for the purposes of this discussion, what would be like a more pertinent goal that you have set for your school, building or your district? I can actually start. I don't work with a particular school, but I work with a couple of schools. And I think overall, working with them, one of their goals would be to fully stabilize the tier 3 services. And especially, so think about like the one-on-one therapy caseload. So, outside screening, schools also do like a referral system so that they can like identify students at risk. So there's always like a shortage of mental health providers in the schools. And I think one of like the biggest goals that schools want to achieve is kind of balance out caseloads. So that way, all children who are at risk or who are identified are getting some form of services. And I think now thinking about it, it's more than tier 3. So think about the tier 2 and the tier 3. So I think one of like the biggest goals at schools in speaking and working with schools they have is being able to like have enough providers to satisfy the needs of the students who are being either referred or screened as high needs or at risk.
At North Summit, I think we're just starting off a little bit slower with the tier 1 screeners and whatnot, and starting like the ideas of, can we do screening as kind of a tool to assess school climate? Can we start off with just one classroom at a time, or just use the data to help you with the referral process you already have, as to not like replace the systems already in place, but just aid and kind of add to how it's going. And then next year, maybe working towards being part of the full collaborative in that way.
Thanks for sharing that, Molly. Yeah, and I think it's always like a good place to start small, even with screening. Screening can be a lot, especially if your goal is to screen the whole school or the whole district. So even starting small, a small goal, like our goal would be to screen 2 classes during the fall, is a good goal to have.
So our current goal is to establish a solid mental health team for our building. And we just had our first meeting last Wednesday. So we're excited. They have lots of ideas, but we're kind of trying to target to kind of fold it. We want to try to start having some tier 1 interventions and kind of programs in place. So that's kind of the big, and the other thing is kind of partnering with more services in the community so that we can start and have a good referral process. So those are their 2 main goals right now.
Those are really great goals, Liz. And I do like, having kind of focusing on building wide. It's also just like, let's start here and let's see how we can expand once we have a better solid process.
For our school, I would like to see a solid response rate for the screening that we're doing across the both grade levels, so that we can really target some tier 1 and really put something into place like school wide and really look at the data that we have, and to really, I don't know, feel like we have some information to look at and then something to do with it too, if that makes sense.
Yeah, so would it be like the more social emotional pieces for tier 1, or would it be like the more screening, like school-wide screening? I know Slixie Bryant already does the school-wide screening. So are we thinking like the more SEL pieces?
Yeah, probably for tier 1. I'm thinking, especially since the screener is more like a climate, almost like a climate survey, right? Just to see what areas we can, really focus on for all students, and then like put something into place systematically that we know all kids are getting, and then look at the data, at the end of the year to see how that worked.
Yeah, we're excited to have the first data point this fall, so we can definitely explore and see what those needs are.
I think one thing to think about for folks that may not be here and maybe reviewing this later on and who don't have goals at this point, there may be some consideration like, what should my goal be, or where should I start with all of this? And I think that's going to be a decision based on looking at these core features, thinking about the climate at your school. What are the things that you've noticed with the students, the staff? What are the things that are popping up most often within your particular building, your particular district, and looking at it from that perspective, and then taking a look at this list here and saying, like, okay, how can we be most effective, or what are the things we need? In some schools, it is starting to build a team, to put even a bare bones team together of a few folks and figuring out like, okay, how do we want to expand this team? And that could be goal 1, and then figuring out how are we going to implement these other services. For other schools, it might be we need some data before we can even figure out who to put together in a team. And so we might focus more heavily on those screeners. And so thinking about that for your site is going to be what helps drive that goal making process. It's the pre-process before even setting goals, is just thinking about which of these areas feels most appropriate based off of what we know about our climate, our culture, and our school.
Thanks for mentioning that, Derek. And I think, yeah, I echo, it's okay that schools currently, if they don't have goals, that's totally fine, because schools are definitely in different places. But I think like when schools do decide to identify goals for themselves, I think just like looking at the core features. And I think, Derek, you also touched on kind of like the action steps. So you do have this goal. Let's break this down and see what our steps are to achieve that goal. So even when it comes to, I'm just again going to go back to screening. For us to screen, what are the things that we need to put in place? So one would be a well-being team. The other would be choosing a screener for your school. How do we get consent from caregivers to screen our students, given the age group? So those are like, for an example of potential actions for screening, which is the bigger goal, would kind of like be those little pieces. And those also take time. And again, we just want to remind school that it's okay, just the process of engaging in like these core features takes time. But we just want to assure schools that we are here to support through the Utah School Mental Health Collaborative in achieving in all of those goals that they want to establish to have a really solid comprehensive school mental health system. So that was just like a little my example of potential actions towards achieving a bigger goal. What are some of so Caroline, I think, sorry, I didn't mean to put you on the spot, but just I think now that we know these schools have different goals, what are some little steps that we can do to achieve those bigger goals?
You think, I mean, in terms of like our own school or speaking to everyone?
Yeah, sorry, I didn't mean to put you on the spot. I think I was just like speaking to everyone. I just want to give yours as an example. So like if SEL would be like a goal, a bigger goal that y'all want to establish, then what are some like little steps towards achieving that goal?
I think, getting the teachers on board, right? Which I think we've done for the most part, making sure that they are willing to support as necessary, or even just like have instructional support personnel in the classroom, giving up their time. I think that's important. I think, community like family support. So I think, and that's something that we've brought, to our SIC. So those are just things that come to my mind right off the bat. Yeah, I don't know. What else? What else am I missing?
Yeah, no, those are really good. Yeah, I mean, getting the teachers on board is like the biggest, I feel like number one, because at a tier 1 level, teachers do play a bigger role in kind of delivering those SEL components to students, right? And other things would be like choosing a curriculum. And I think, again, this kind of goes back to the teachers, like what is a curriculum, that's evidence-based, but also is acceptable to teachers, something that is feasible for them to do within like all of this academic instruction. Yeah, so those are like some really good potential action steps. And I'm really glad to hear that, the teachers are on board. So that's like one step towards the goal. Yeah, I want to be a little mindful of time, but so I'm really glad that we could kind of, really focus on where schools are currently with, some of these core foundations or core features, and then really envisioning like their existing place right now, but like how do we move forward and how do we strive to introduce different or like newer core features or even modify existing core features that schools have. So that kind of concludes our first module 1 training series of our 8-part series. This module was the foundations of school mental health, and it really reflected on like the overall bigger picture of the other series that we will introduce in the coming months. So I just wanted to give everyone a reminder that our next series will be held on the first Wednesday of November from 9 a.m. to 10 a.m. Mountain Time. So please do join us. We will be sending y'all reminders to register for this session. We want to give a big thank you to all of those of you who participated and shared some of those experiences and reflections from your school. This slide, we want to mention that, the Utah School Mental Health Collaborative is housed within the UTech Lab. We do have social media pages. We do have a website. So if you do scan the QR code, that will take you to our lab's website, and you can access the Utah School Mental Health Collaborative website. We want to give a big shout out to MSGTC, the National Center for School Mental Health, and also our funders and collaborators. So thank you all for being here. We will see you all next month.